Today's class, we are going to discuss about multi-sectoral approaches for the prevention and control of zoonosis. When we take zoonosis as shared infections, so we must use certain multi-sectoral approaches to manage these zoonotic infections. Otherwise, management by any one sector is near to impossible. So this class is designed to understand such approaches, multi-sectoral approaches applied for the management of zoonotic infections. What is the meaning of multi-sectoral? We are aware about the sector. Any sector is, say, for example, we do have animal husbandry sector, agricultural sector, horticulture sector. So there are many subsectors also in each sector. Likewise, when many sectors, they work together, that becomes multi-sectoral approach. Because zoonotic infections are such dreaded infections. Many players are required to manage these infections. That is why we need multi-sectoral collaborations and multi-sectoral approach to manage zoonotic diseases. More than one sector, when they work together, that becomes a multi-sectoral approach. It is a joint program or response to an event. That's what is the etymological meaning. The literal meaning of multi-sectoral is that more than one sector join hands together, they work together, that is a multi-sectoral. But need not be, all will be working at a time. So what is the explanation for this? When we say multi-sectoral, say for example, if a particular zoonosis management involves a phase-wise control mechanisms. In the phase 1, 3 to 4 sectors, phase 2, 2 sectors, phase 3, take for example another 3 sectors. Like that, they work together to solve a problem. Here it is management of the zoonotic diseases. That's what is the problem here. Okay. So multi-sectoral approach has been well established phenomenon across the globe to manage the zoonotic infections. It requires deliberate collaborations. What is this collaboration is? Collaboration means each sector that is identified based on mutually agreed basis, they collaborate, coordinate, and they work together by taking the other into confidence and to solve the problem. The stakeholders here are many. Okay, that depends on the type of the zoonosis that is under question. Say, for example, if it is a rabies, many people are involved. If it is a brucellosis, compared to rabies, less sectors are involved, less stakeholders are required. If it is some other infection, the number of the stakeholding or the groups differs. Okay. What are these? Who are these stakeholders? Or what are these agencies? These are either the government agencies, federal, or they are civil society, people put together forming a group or making a professional group, making an association, making people for a particular event. Let it be the rabies control, let it be the brucella management, let it be the foodborne infection management, the civil society or the organizations or the associations, or the private sector. Private sector is a corporate sector, and even the certain non-governmental organizations also. They all join hand together as a stakeholder, representing different sectors and working together to solve a problem is a multi-sectoral approach. So the sectors here that, as I told you, it differs from the problem identified. For Japanese encephalitis control, the type of sectoral collaboration that we expect is different from tuberculosis control, because that is a vector-borne disease and this is an airborne disease. Whenever a disease is vector-borne, we need to manage the vectors. And whenever the vectors have to be managed, we need accordingly those professionals and that infrastructure to achieve that. So the type of the problem determines the stakeholding or the groups involved in the multisectoral approach, and ultimately they all work together to solve the problem. Here we also require the policy support also. Many times, ultimately, zoonotic diseases are dreaded diseases. No one wishes to have them. No country wishes to have the zoonotic disease burden. That is why the people, the organizations, the government, the non-government organizations, all of them, they work together in this multi-sectoral approach. The engagement of multiple sectors is the problem specific or the problem identified. Say, for example, elimination of rabies, dog-mediated rabies by 2030. It is a global agenda. Many people are working in this. Many groups are working in this. Many sectors are involved in this. Okay. Then what is the difference between group and a sector? Say, for example, if it is an animal husbandry, or the health or the public health, agriculture, these are all the sectors. Within this, there can be different groups. Okay, that is what is the stakeholding. That is what is the groups that work within a sector, and they all join hands together. That's what is the approach. Okay, multiple sectors, multiple partners, diverse knowledge, expertise. Okay, to catch a dog for rabies control, an engineer may design certain device to catch hold of that animal. Okay, once the animal is caught during its captivity period, the engineer can design a better cage for that during its castration and spaying and other things that is done in captivity. Different sectors have different reaches and different resources. They all to be gathered to achieve a single goal of controlling, managing, eliminating zoonotic diseases. Okay, it is a combined strength. It's a combined strength of many sectors. Thrust is given to the problem and problem is solved. That's what is a multi-sectoral approach. These cartoons below, they depict certain working examples in they solve the different kinds of problems using this multi-sectoral approach. Say, for example, in one particular problem solving, the nutritional promotion, agricultural interventions, education to the people, involvement of the government, involvement of the other sectors associated with that one. Ultimately, they all lead to the better child health. Okay. Likewise, if you see the next one, health, if at all, it has to be promoted. So the departments that are associated, each department represents here the sector. Let it be Department of Women and Child Development, let it be the Public Health, let it be the Education Department and other departments. They all join hands together and they promote the health. This multi-sectoral approach is promotion of the health. Next, multi-sectoral approach for solving the nutrition or food security related problems. So the varied sectors, they work in different spheres, and ultimately the aim of this particular multi-sectoral approach is to enhance the better nutrition and better food security in an area. Okay. Likewise, there are large number of multi-sectoral approaches that are used to solve a particular zoonotic problem or a health problem or other public health related issues in general. So after having understood the meaning of the multi-sectoral, at times we hear in public health multidisciplinary. Okay, what is the meaning of multidisciplinary? Many disciplines They work together. Okay. Say, for example, in a single ministry or a research institute, there are many people. There are physicians, there are nurses, there are veterinarians, epidemiologists, laboratory scientists, basic scientists, and other health professions. Okay, they all work together. Okay, working together. These are all the disciplines. These disciplines, they work together and to solve the problem. Okay, it refers to an approach which creates a single team from a range of different disciplines or fields of expertise. Multidisciplinary approach can tackle complex situations or problems by using the combined skills of different disciplines to develop a holistic solution. Okay, when these people, they work in a coordinated way, in an interdependent way, in an intercommunicated way, okay, the disciplines, okay, you can see the cartoons here. So ultimately the problem is solved and we achieve a success in solving such problem. We hear one more term known as the interdisciplinary in public health. What is this interdisciplinary? In between the departments. It involves combination of 2 or more disciplines into one activity. Say, for example, we are undertaking one research, and in this research, we combine the 2 or more departments. And these 2 or more departments, they have taken certain responsibility and they will contribute in that. This is interdisciplinary. Okay, so veterinary public health or zoonosis management indeed requires all these activities. All these activities need to be undertaken in order to solve the problem. Here in this particular class, it is management of zoonosis, prevention of zoonosis, control of zoonosis, elimination of zoonotic infection, eradication of a zoonotic infection. At times, we hear a term known as One Health. What is this One Health? Regarding One Health, we have discussed in detail. Now, definition and all you are aware of. One Health approach indeed involves multi-sectoral collaboration or multi-sectoral approach. Without multi-sectoral approach, One Health cannot be achieved. What is One Health? Health, maintaining health of the people, animals, and ecosystems. That's what is One Health. And in order to achieve this, one particular sector cannot achieve the goal. That is why the responsibility has to be divided into different sectors. They have to undertake their own activity, ultimately achieving what is desired. So One Health approach indeed involves multi-sectoral collaboration between these sectors: health sector, animal health sector, health in the sense human health sector, animal health sector, and environmental health sector. They work together in a coordinating way. They collaborate with each other, they communicate with each other, and they take a particular task, they achieve. Okay, say for example, you are building a home. The plumber does the pipings and fittings. The construction people, they do the plinth and brick work, the concrete work and other things. The people who are having expertise in creating the iron skeleton, they are the one, they do that job. The people who are associated with tiling and all, they put tiles and all, window fitting and all other persons. So likewise, the painting person, likewise the final decoration and carpenter work. So each task is divided into different things. When all of them, they contribute their part, your home is ready. So likewise, in One Health, okay, One Health is not something imagined in the space. One Health with respect to what we have to talk. One Health, is it for the management or control of the rabies? One Health approach for the management of the COVID-19 right now. One Health approach for the management of zoonotic tuberculosis. One Health approach for the management of the anthrax. We have to specify what is the area in which we are applying this One Health approach. Otherwise, simply talking One Health approach doesn't make any sense. Okay. But the aim of the One Health is the promotion of the human health, animal health, and environmental sectors. Ultimately, the global health, eco-health, what we call it as, has to be preserved and maintained and is promoted or augmented. Health is to be augmented or the promoted. In doing so, we have to eliminate certain factors which are otherwise detrimental to the positive health of the ecosystem or eco-health. Ultimately, a human being or the animal have to survive in the ecosystem. That's why we have to achieve the eco-health. Clear? Okay. This slide talks about if we implement multi-sectoral collaborations, what kind of benefits we are going to get. And if we implement One Health collaboration, One Health multi-sectoral collaboration, collaborative type of, coordinating type of, communicating type of approaches, how we are achieving zoonosis management. That's what is the requirement. Okay, let us discuss them one by one. Number one, response to zoonotic disease events and emergencies. If we have a multi-sectoral approach, we can attend a zoonotic disease as early as possible, more timely and more effectively. If there is a delay in attending the case, in attending the zoonotic infection, there is a devastation, because zoonotic infection cannot be just stagnant in few individuals within the population. They tend to spread in the population, thereby affecting large number of human, even animal populations. That is why if you have a multi-sectoral approach, you can rapidly, as early as possible, timely intervention you can do. That is easy, because you will be having at your disposal the information and communication tools. You will have the geographic information system. You will have the global positioning systems. You will have the logistics support. You will have the other vector control and other vector dynamic related aspects. So all of them, when they are inputs to you, you can solve as early as possible a zoonotic issue. Okay, I'm not taking any particular example here, any zoonotic infection. Next, all sectors have the required information. If imagine a situation, we are assuming that we want to solve a problem. Okay, we want to solve a problem, and we are assuming that each one is doing their best, but there is no communication between them. If there is no proper communication between them, it could be so that the same task is being repeated by some of the sectors when they work in isolation, because there is no information and communication. Rather, when all these sectors are well informed about their task, when the task is divided, when they contribute, ultimately in a less time, as in the first point, we'll achieve the required result. That's what is. All sectors will they will be having the required information. I will be clear. If I am representing one sector, I am clear that what is my domain, what I need to do. This much is my job. Say, for example, rabies control. If human health people, they vaccinate and manage the bites effectively in the human population. Veterinary side, they vaccinate the animals and manage the animal populations, veterinary side. Municipal corporations and all, they will see that strays are controlled. The activities are well defined, and they are specific to that particular sector. And when this information is communicated, so we can achieve a better result with respect to management of rabies in a locality. Decisions are based on accurate and shared assessments of the situation. Many times, especially in the foodborne zoonosis, we undertake the risk assessment. The risk analysis part, you know it, okay? Hazard identification, hazard characterization, all those things. So we will be knowing the assessment situation. And based on this assessment situation, we will take certain decisions. And again, to arrive at a decision, we need inputs from different sectors. Whenever we use a multi-sectoral approach, that is hastened. This is making processes hastened, and we can correctly assess the situation and deliver the best. Fourth, accountability to each other. Okay, I am doing my part, you do your part, the other person will do other part. Okay, the sectors within them, they cross talk each other, and they will achieve the desired goal. And to decision makers, ensure action by all sectors. Say, for example, one particular problem has to be solved. If one sector gives one kind of recommendation, other sector gives the other kind of recommendation, then how they call policy makers using public money? Okay, they will address the issue. It becomes difficult for them. If these people talk, discuss, brainstorm, and come at certain conclusion, and then recommend a single recommendation, then governments or the federal agencies, they will easily take that one and they will implement that one. So there is more accountability associated with the policy related or decision making related aspects. Fifth, it is a spillover. Regulations, policies, and guidelines are realistic. Since it is not the offshoot of a particular sector, when multiple sectors, they feel the same thing through their research and development, the observations are more realistic, and such observations are more acceptable. And since there is a lot of discussions, scientific deliberations, and all that happen, brainstorming that happen, only practical implementable type of recommendations are put forward before the regulatory agencies, so that they are taken up by the regulatory agencies, and that comes in the form of a policy or the guideline, and they are implemented at a locality, and they are applied to solve the problem. Okay, it is true with respect to solving a zoonotic problem at the local level, regional level, national level, or same thing applies even to the international level. Only thing is the players are different. The players are either at the local level or at the global level. But ultimately, this is the mechanism. Sixth, all sectors understand their specific roles and responsibilities. In a coordinated way, collaborative way, in a either way, communicating way, when things are dealt upon, the problems are discussed upon, each individual will understand their responsibility and the specific role, and they will collaborate in such a way that they can't really contribute to the problem that has been assigned to them or it has been identified. Clear? Seventh, technical, human, and financial resources are effectively used and equitably shared. When people of different sectors, they cross-talk, they collaborate, obviously, in a least cost formula, they will solve the problem. That's what is the resources. The other things, they are effectively used. Eighth, gaps in infrastructure, capacity, and information are identified and filled. If at all there are any gaps, let it be the knowledge gap, let it be the resource gap, let it be with respect to the gap with respect to infrastructure, they are all addressed, and such gaps are filled up. Okay. Last, advocacy for funds, policies, and programs are more effective. These are, I already explained this. These are all some of the indicative points, indicative benefits of using multi-sectoral collaborations for the management of zoonotic diseases. These are the generic points, what I talked so far. They are implementable for the management of each and every zoonotic infection, but the sectors are different. The type of collaboration that we expect, they are different, which is disease specific. The type of management that we apply for the Japanese encephalitis, similar kind of managemental practices can be applied for the chikungunya management, but they bit differ with the rabies. It's a viral infection. They bit differ with viral infection, but with 100% Prevention possible with the vaccination. It bit differs from tuberculosis, century-old disease, human problem, animal problem, zoonosis issue. Management is difficult because it is respiratory borne. So the type of collaboration that we expect is different. Ultimately, the R&D, okay, research and development that occurs in the research organizations, academia, universities, and all, they help us to enhancing the knowledge about the zoonotic infections. Many national, international organizations, the research institutes, the research organizations, they also contribute immensely to solve a zoonotic infection problem. So let it be with respect to the inventions and discoveries related to the diagnostics, better therapeutics, better prophylactic agents, metaphylactic agents, and better environmental management solutions. When they are all available, they have to be evaluated and validated. For this, we require again the government and non-government bodies to evaluate and validate their efficacy, effectiveness, and all. Once this is being done, they have to be promoted by the governments. Whenever they are approved and promoted by the governments, some corporate sector, some non-governmental organization, or even the government organization take up the manufacturing or bulk synthesis of those things. When these are available, they have to be logistically made available at the point of requirement. Whenever they are made available at the point of requirement, they cater their needs. And when these needs are catered, the problem is solved. So this is a basic skeleton of any multisectoral approach to solve a zoonotic infection. Many international bodies and the regional frameworks, they promote the multisectoral approach for the management of zoonosis. Okay. So they align with the existing international and national frameworks. Even for the management of the COVID-19, the G7 summit has recommended One Health and intersectoral collaborations, multisectoral collaborations, interdisciplinary collaborations. So they are the must for solving such catastrophes. Otherwise, it is not possible. So all these national and international, supranational agencies and the frameworks, they promote the multisectoral approach. They promote sustainability using multisectoral One Health approach for the management of the zoonotic infections. Most countries work within one or more frameworks that require coordination across sectors and the disciplines. This is what is multisectoral, intersectoral, interdisciplinary approach, what I talked earlier. Okay, all these agencies which are working at the global level above the nations, they all promote this one, because one single sector cannot achieve the solution. That is why we have to join hands together. International health regulations, OIE standards, Sustainable Development Goals of the United Nations, the regional frameworks that have been constituted to solve a particular problem, or regional trade promotion type of frameworks, Global Health Security Agenda, Codex Alimentarius Commission, Antimicrobial Resistance Framework, International Food Safety Authorities. So they all promote the intersectoral collaborations. Okay, multi-sectoral collaborations. Above all, the tripartite partnership. Okay, the tripartite partnership, what we talk about. So it what you can say, it promotes the multisectoral approach for the management of the problems identified, including zoonotic infections. Take, for example, one case study, rabies control. Rabies control. In order to control the rabies, we need government agencies. Government agencies, they establish hospitals, they recruit the veterinarians, and they, through municipal corporations, okay, local self-government, they help in the stray animal control and other things. Okay, starting from the case management to the vaccination and catching them, population control, all these things. These are the job assigned to the government organizations. The non-governmental organizations, they do their best. Activities are again shared. Many supranational organizations, including the tripartite partnership, they work in this direction. Let it be the WHO's regional office, let it be the OIE, let it be FAO. They all work in a coordinated way. They rely on multi-sectoral approach. Voluntary organizations, we have many organizations in India. We have a large number of groups, associations that are working for the elimination of the rabies. There is a global alliance on rabies control that is targeting rabies-free world, canine-mediated rabies-free world by 2030. Many people join hands together. It is also a multi-sectoral approach. So like this, we use different sectors' contributions to manage effectively these zoonotic infections. That is what is the multi-sectoral approach is. Okay, the multi-sectoral approach in a larger perspective, is a requirement to solve the zoonotic infections. That is the one which is a required one. And when we discuss each and every zoonotic infection, we will discuss about how these multi-sectoral approaches are applied for the management of a particular zoonotic infection.